Thank you, Joe. John, I'll say hello and you can say goodbye this time.
Well, first of all, Lou, thank you. This has been I thought, a tremendous morning. Look, this bill is not a perfect bill, and everybody knows that. And just like any other bill, it has to be worked. And I think that what this bill will do will provide for so many people to be able to access the healthcare. And how could you possibly think that that is not a good thing? That is a wonderful thing. It'll take care of our children as they look to establish their careers. It'll help the senior citizens. It'll put money into wellness programs that will help prevent disease down the road. It's a tremendous, tremendous step. And as you said, Joe, socially, it's just the right thing to do. So, yes, will there be some bumps in the road? Will there be some pain? I believe that will come along with it. But the good that this bill will do will just be a tremendous, tremendous opportunity for all of our folks. And Doctor, you have to mention you don't have the opportunity, to collectively bargain and things like that. If you'd like to wait afterwards, I'll be happy to discuss that with you, and we can have a conversation.
Better bring your lawyer. Cindy, why don't you give us your final thoughts?
Just a simple statement that now that the bill is over, as we've talked about several times today, you've got several years of real work to go. And if there is a lesson out of Massachusetts, I would urge everyone to take a strong look at it's this. When we passed that law and the community began to implement it, it literally was everyone coming together, all the stakeholders, right? We used to joke all the time that our big ceremony we had at Faneuil Hall was literally all of us linking arms, singing Kumbaya, and walking off the cliff together. But the most interesting thing is those arms have stayed locked. The entire community has stayed locked in place for the last 3 years. The business community, the labor community, the doctors, you name the advocacy groups, the legislators, every segment of that community has stayed locked. Because you will find problems you never anticipated, because you're not going to just be given something and told, do it exactly this way. It's something you've got to figure out how it works for you. And you got to work together to do it, because it's tough, and everyone will continue to have to give in different areas as you make your way through it. But if you do, you find yourself in a few years with 98%, 99% of your population insured. Now that's pretty incredible, but you got to hang together to get there.
Thank you, Cindy. 6 more 1-minute speakers, and then we'll do the raffle for the Yankee tickets and the Broadway shows and whatever team plays in Queens. Ben.
Nice. So from a small business perspective, we look at healthcare as an engine of growth for the economy. Right? This is an economic development issue for us, because taking this burden off small business means more innovation, it means more jobs, and it means more profits, which drives more jobs again. I did a study that modeled the House and Senate bills that you have in your packets, which demonstrate about a $50 billion savings over the next 10 years to small business. This is not only going to improve the New York economy, it's going to reduce one thing that I didn't talk about in my speech, which is job lock. And I describe this as the single woman, the mother of 2 who works at Google, who has this great idea, who is too afraid to go out in the marketplace to get her own health insurance for fear that her kids will lose health insurance. Under this program, those entrepreneurs will step forward and create new jobs. And I think at its base, that is the big win around this health bill. It's really going to unlock a lot of innovation and a lot of new jobs for the state.
Thank you, Ben. Joe Baker.
Thank you. I think, my goal, and I think something is really to get the right information out to people, and I think the Secretary said this as part of her remarks, is that I don't think the misinformation campaign will end. I think we could have had much more representation up here than we have, but I think we had a good discussion of most everybody saying, are there some negative things here? Yes. Are there some positive things here? Maybe they outweigh those things, but there's a lot more work to do. I mean, I think that's the real discussion that we all need to engage in New York, and that we all need to engage in across the country. And we're going to be dealing with a large segment of the population that wants to repeal the law. And not necessarily because they don't believe there's some good in it, but for political reasons. So I think that, as Cindy is saying, we've got a lot of work to do here in New York. We do need to work together and find common ground. And that, this is a new platform that we'll be working on, for all of our lives to make better and better and better. And that's what we really need to start doing right now.
Thank you, Joe. Lorraine Brown?
Yes, I just want to follow on Joe's point. I think we have a lot of work to do, but I also think that those of us who are healthcare providers, and particularly large healthcare providers with hospitals, nursing homes, which was not talked about today, have a responsibility to really change the way we deliver services and to work very closely with the state and the federal governments to make sure that the way in which services are reimbursed are aligned with the right way to deliver care. Frankly, there need not be a competition between the healthcare provider, hospital or otherwise, and the health plan. We at HHC know that, in fact, if you form a partnership with your health plan, we happen to own one, but that need not be the only condition. If you form a partnership with your health plan, it benefits the provider network, it benefits the physicians and the caregivers, but most importantly, it benefits the patient population and the community that we serve. Thank you.
Thank you, Lorraine. And Catherine Ibaka, you want to conclude? Or
Just
closing
I
remarks?
hate to reiterate what other people have said, but it's so important. We have to stay awake because the devil is in the details, and work with the state to make sure how the plans are implemented makes sense. I'm really concerned about capacity building, and we also have to fight for the demonstration dollars. There's going to be a lot of dollars available around public health and preventative care, and we all stress primary care is the linchpin of making a healthy America. And so the dollars are going to be available for IT and medical home, coordinated care, and we have to make sure we get those fair share of dollars. And the only way we're going to do that is a united front, all of us being informed, being smart consumers, knowing more about the healthcare system, leaving here today and educating our partners in business, our neighbors, and everyone else about the work ahead.
Catherine, thank you. Elizabeth, you never sleep, so you'll be awake for all of us, correct? And now your closing comments.
Thank you, Lou. I think I really appreciate what everyone said so far, and I think this implementation stuff is really hard. But I think we need to really have a lens, a consumer, or how the patient, how the uninsured person is going to interface with this system. We need one exchange that can process both Medicaid, Child Health Plus, individual direct pay, group coverage. We need to, all these sort of interfaces between our sort of very complicated healthcare system is going to be so daunting for the individual. Am I subject to the mandate? Which program do I go in? How do I use it once I get enrolled? All of those questions are going to be wildly overwhelming, and so we're lucky because there's a little bit of money in the federal bill, $30 million, to help with consumer assistance, and I really hope that New York will think wisely and strategically about how to use their little tranche of that and support really engaging consumers, because this system will not work for anyone if the consumers don't know how to use their health care or how to activate and get involved with it in a meaningful way.
Thank you, Elizabeth. And now, Troy, you'll tell us how happy you are that this has passed.
I am happy, and it's really both the challenge and opportunity of a lifetime for all of us, those of us in state government. I know Governor Patterson, my boss, Superintendent Wren, are absolutely focused on maximizing the opportunities for New Yorkers, as well as trying to avoid some of the pitfalls. And we, fortunately in New York, have a large cachet of really smart, very involved stakeholders who are going to help us try and avoid some unintended consequences and really make the most out of a great opportunity. And I look forward to working with folks here on the panel, as well as a lot of you in the room and elsewhere.
Thank you, Troy. Let's hear it for the panel.